get ready because we're going to take a deep dive into outbreak investigations today.
That's right, outbreak investigations.
You know you're preparing for that big presentation on infection control.
Yeah?
And you really want to wow everybody.
I want to know your stuff.
So consider this deep dive your secret weapon.
Absolutely.
We are going to be cracking open the APIC textbook
Okay.
on outbreak investigations.
Sounds good.
And trust me, by the time we're done with this deep dive,
Mm-hmm.
you will be just dropping knowledge bombs.
He'll be in there.
Oh, like pro.
Yeah.
So imagine you're at your presentation
Okay.
and someone asks you a really hard question
They always do.
about outbreaks, like how much they cost.
Mm-hmm.
And you can confidently say, even a small outbreak can cost a hospital tens of thousands of dollars.
Wow.
Things like lost revenue, increased expenses,
Yeah.
the whole 9 yards.
That's the kind of impact we want.
That's what we're going for.
All right, so let's start with the basics.
Okay.
What exactly is an outbreak?
Yeah, what is it?
It's not just a few people sniffling around the office.
There gotta be more than that.
It's a sudden spike in cases of a disease.
Like a lot more than you would expect.
Way more than expected.
So think about it like a storm that suddenly hits your hospital,
Oh.
and you have to act fast before it turns into a hurricane.
Yeah.
And just like storms, outbreaks can be different.
Oh, yeah, different types.
So you've got your common source outbreaks.
Like everyone ate the same potato salad.
Okay, bad potato salad.
Yeah.
And then you have these propagated outbreaks.
Those are the ones spreading from person to person.
Okay.
Like a chain reaction.
So they're harder to contain.
Much harder.
So we've got these different types of outbreaks.
Mm.
The clock is ticking.
Yeah.
What do we do first?
Okay, so first we got to verify the diagnosis.
Be sure it's real.
We need to make absolutely sure that everyone is actually sick with the same thing.
Don't want to jump to conclusions.
So we don't want to be chasing the wrong culprit.
Right, we got to have evidence.
Evidence.
So then we'll
Then we start gathering information.
round up the suspects.
We create what's called a line list.
A line list.
Yeah, think of it like a detective's evidence board.
Oh, okay.
It has all the details on each patient.
So like their symptoms and stuff?
Symptoms, when they got sick, where they've been,
Okay.
even who they might have interacted with.
Wow, okay.
It's all there.
So we're basically mapping out the outbreak.
Yeah, we're looking for connections, patterns.
Trying to connect the dots.
Exactly.
Right.
And that helps us narrow down our focus.
So we might see like a bunch of cases who all had the same procedure.
Right. Or we're all on the same ward.
Oh, okay.
It gives us clues.
So then is it time to start like swabbing everything?
Oh, hold on there.
CSI time.
Not quite CSI. Environmental sampling can be helpful,
Okay.
but it's not always necessary.
Really?
It's more strategic than just swabbing everything in sight.
So we have to be smart about it.
We need to target the right places.
Based on what we think is causing the outbreak.
Exactly.
Okay, can you give me an example?
Sure. Let's say we think it's Pseudomonas.
Pseudomonas.
Now, that little bug loves moisture.
Okay.
So we'd focus on things like sinks, liquids, damp areas.
Okay.
Not just random doorknobs.
Oh, okay.
But if we're dealing with something like Acinetobacter,
Uh-huh.
which prefers dry surfaces,
Dry surfaces.
would prioritize equipment, furniture, things like that.
So like all that microbiology stuff we learned
Exactly.
about different bacteria.
It all comes together.
It's all making sense now.
Understanding the germ helps us target our efforts,
Okay.
and that increases our chances of actually finding the source.
So let's say we figured out what's causing the outbreak.
Okay.
Maybe it's a piece of equipment or a procedure.
Right.
What happens next?
Well, we can't celebrate just yet.
Oh.
Remember, we're trying to stop the spread.
Right.
So now it's time to take action. Implement control measures.
Based on what we learned.
Exactly. It's not just about finding the bad guy.
Right.
It's about stopping them from doing any more damage.
So what kind of action are we talking about?
It could involve anything.
Like what?
Changing a procedure, isolating patients,
Okay.
even stopping certain activities if they're risky.
We're basically changing things up to stop the outbreak.
Exactly.
Okay, and I'm guessing communication is really important.
Communication is key.
Okay,
We need to keep the staff informed
so they know what's going on.
every step of the way.
Okay.
They need to understand why it's important.
Mm-hmm.
That human element is really important for success.
Like a team effort
Everyone working together.
to contain the outbreak.
Exactly.
Now, earlier you mentioned this thing called an epidemic curve.
Oh, yeah.
I really want to know more about that.
It's a powerful tool.
Okay.
It helps us visualize the outbreak's timeline
Ooh.
and gives us clues about how it's spreading.
So are we going to talk more about that?
We're going to dive deep into the epidemic curve.
Okay, great.
Stay tuned.
I can't wait. Okay, so we're back and ready to tackle this epidemic curve.
Yes, the epidemic curve.
It sounds kind of intimidating.
Well, it's really not that bad.
You said it's like being a data detective, right?
It is. It's like visual storytelling with data.
Okay, I like that.
So picture a graph, all right?
Okay.
Time on one axis and the number of cases on the other. And
Yep.
each bar in the graph shows a specific time period
Okay.
and the height of the bar. That tells you how many people got sick during that time.
So it's like we're watching the outbreak unfold.
Exactly. It's a visual timeline.
That's really cool, but how does that help us know what kind of outbreak it is?
That's where the shape of the curve comes in.
You mentioned common source and propagated outbreaks?
All right, remember those.
Yeah, so the curve can tell us which one we're dealing with.
Often, yeah, it can give us a visual clue.
Okay, so spill the beans.
What kind of shapes are we talking about?
Yeah, give me the details.
Okay, so let's say everyone got sick from that bad potato salad.
The common source outbreak.
Exactly.
Okay.
The epidemic curve for that would probably have a really sharp peak,
A sharp peak. Okay.
showing lots of people getting sick all around the same time.
Because they all ate the potato salad at the same time.
Right. Everyone was exposed at roughly the same time.
So they all get sick within however long it takes for that illness to show up.
Exactly. Within the incubation period.
Okay, so it's like, boom, a ton of cases, and then it calms down.
Pretty much. But what if the exposure wasn't a one-time thing?
Oh, good point.
What if it was, happening over a longer period?
Okay, so like not just one bad batch of potato salad.
Right. More like a leaky pipe that keeps contaminating things.
Okay, got it.
In that case, the curve might have several peaks or even look flatter.
Oh, interesting.
It all depends on how and when people were exposed.
So the curve tells us about the common source.
Right, like how long people were being exposed to it.
Sneaky, leaky pipe.
Now, let's talk about those propagated outbreaks.
The chain reaction ones.
Right, person-to-person spread.
So what do those look like on the curve?
Those usually show a much more gradual rise in cases
Okay, makes sense.
because it
Yeah.
takes time for the illness to pass from one person to the next.
It's not like everyone ate the bad potato salad at the same time.
Exactly.
Okay.
It starts slow and then builds up as more people get infected.
And sometimes we see those secondary and tertiary waves,
Right, like ripples spreading outward.
which probably makes the curve look even more complicated.
It can, yeah.
So if those later cases start popping up.
The curve might have multiple peaks,
Okay.
with the space between them reflecting the incubation period.
Oh, that's cool.
It's like watching a wave pool.
Each wave is a new generation of cases.
Exactly.
So we can tell what type of outbreak we have
Often, yeah.
and how it's spreading
Mhm.
and even get hints about the incubation period.
The epidemic curve can tell you a lot.
It's like a cheat sheet for outbreak detectives.
I like that.
But I'm guessing it's not always this straightforward.
You're right, especially in a busy hospital. Things can get messy.
In what way? What makes it tricky?
Well, remember how some infections don't cause symptoms right away?
Oh, yeah, those sneaky ones.
So someone could be spreading the bug without even knowing it,
Okay.
which makes it harder to pinpoint exactly when they were exposed.
And that makes it harder to figure out the incubation period from the curve.
Exactly. It's like a puzzle with missing pieces.
And hospitals have so many people coming and going.
It's a challenge for sure.
It's like trying to track a chameleon that's constantly changing colors.
Adds a whole new level of complexity.
Definitely.
And on top of that, we could be dealing with multiple transmission routes at the same time.
Oh, so like you could have the bad potato salad.
Right. The common source.
But then it starts spreading person to person.
Exactly.
So the epidemic curve might look like a mix of different outbreak types.
It can, and that's where things get really interesting.
It's like the curve is telling a multi-layered story.
And we have to figure out all the chapters.
This is making my brain hurt.
Don't worry, it's not as complicated as it sounds.
So I don't need a PhD in statistics to understand this.
No, not at all.
Okay, good.
There are lots of tools and resources to help us.
Like what?
The CDC has some great stuff.
Oh, okay.
They have user-friendly templates and guides.
So we can be data detectives without going back to school.
Exactly.
That's a relief.
So you can create and analyze these curves without pulling an all-nighter.
Perfect.
No need to be a math whiz.
This has been so helpful. I feel like we've really cracked the code on outbreak investigations.
I'm glad to hear that.
But what happens after we've solved the mystery and contained the outbreak?
Then it's time to share what we've learned.
Share our detective work with the world.
Exactly. Think of it like publishing our findings in the Outbreak Investigation Gazette,
Ooh, I like that.
a journal dedicated to all things outbreaks.
But are we talking like a full-blown novel here?
Maybe later. But for now, it's about clear and concise communication.
Okay, no medical thriller just yet.
We want to get the key points across in a way that's informative and engaging.
Like a case study.
Exactly.
Okay, so how do we actually do that? What does sharing our findings look like?
Usually, we put together a final report.
Summarizing the whole investigation.
Exactly. It becomes a valuable resource for our facility and the healthcare community.
So it's like a guidebook for tackling similar outbreaks in the future.
That's a great way to put it.
What kind of information goes in this report?
Everything. How we spotted the outbreak, the steps we took,
Okay.
the control measures that worked, the results we saw.
What about the roadblocks?
We include those too, and any lessons we learned,
Even if they were from mistakes.
especially from mistakes.
Because even the best detectives mess up sometimes.
Absolutely. And those mistakes can be the best learning experiences
That's true.
by being open about what worked and what didn't.
We can help others avoid those pitfalls.
Exactly. And navigate similar situations more smoothly.
So it's all about transparency and collaboration.
Exactly. Working together to improve things.
Who gets to read our masterpiece?
We share it internally with staff and leadership.
Okay.
Helps everyone learn and prevent future outbreaks in our own facility.
But it doesn't stop there, right?
Nope. We can also send our findings to health departments
Local and state.
and national organizations like the CDC.
Wow.
They can use this information to track trends
And spot emerging threats.
and develop guidelines for other healthcare facilities,
So our investigation could have a ripple effect.
preventing outbreaks in other places.
That's amazing.
And sometimes we might even publish our findings
in medical journals.
or present them at conferences,
Wow, we're going big time.
spreading the knowledge even further.
So we're sharing internally, reporting to authorities, and publishing for the world.
It's a multi-pronged approach.
This deep dive has been incredible. I feel like I could lead an outbreak investigation now.
That's the goal.
But before we wrap up, what about the patients?
Ah, yes, the patients.
How do we communicate with them during an outbreak without causing panic?
That's a crucial question, and one we'll address in our next segment.
Okay, looking forward to it.
Dude.
All right, so we've talked about investigating outbreaks, tracking them down, sharing what we learned. But what about the people at the heart of it all? The patients. How do we keep them in the loop without, freaking them out?
Yeah, communication with patients during an outbreak. It's a real balancing act. We want to be open and honest, but we also don't want to create unnecessary anxiety.
Sounds tricky.
It is. It's about finding that sweet spot where we give accurate info, but don't fuel the fear.
So what are some key things to remember when we're talking to patients during an outbreak?
Well, first off, we got to keep it clear and simple. Use plain language, ditch the jargon, stick to the facts.
Yes, the facts, ma'am.
Exactly.
Yeah.
Patients need to understand what's happening, what steps are being taken, and what they can do to stay safe.
Right. No need to overwhelm them with medical mumbo-jumbo.
And honesty is super important. If we try to sugarcoat stuff, downplay the risks, people lose trust.
Yeah, nobody wants to feel like they're being kept in the dark.
Exactly.
Mm.
They need to know we're being upfront, even when the news isn't great.
So transparency builds trust. Makes sense. But what about those patients who might be at risk but aren't sick yet?
Ah, that's a tough one. Deciding whether to tell those patients they might have been exposed, that takes careful thought. We got to weigh the severity of the illness, how easily it spreads, and the pros and cons of telling them.
Sounds like a lot to consider.
It is. It's a big ethical question. Often involves talking to leadership, risk management, even ethics boards.
It's not a one-size-fits-all situation.
Not at all. Each situation is different. We need to be sensitive and thoughtful.
What if patients hear about the outbreak from someone else or see it on the news before we can tell them?
That's why hospitals need to be proactive. Have resources ready to go, like handouts or FAQs on their website,
So people can get accurate info right away.
even if they hear about it from somewhere else.
Okay, so be prepared. Have a plan. This deep dive has been amazing. We've covered so much. From investigating outbreaks to talking to patients.
It's been a journey, that's for sure. But I think the main takeaway here is that outbreak investigations are about way more than just finding the source.
Yeah.
They're about understanding how diseases spread, taking action, and communicating clearly to protect everyone.
So picture yourself back at that presentation, feeling confident and ready to answer any question about outbreaks.
No more feeling intimidated. You're prepared, maybe even a little excited to share what you've learned.
And remember, the learning never stops. The CDC website has tons of info on outbreak investigations, case studies, resources, all sorts of cool stuff.
Keep exploring, keep learning, and keep those detective skills sharp.
That's right. The world of outbreak investigations is full of mysteries waiting to be solved. Thanks for joining us on this deep dive.